How are you, everyone? This is the first lecture in ophthalmic surgery tip and tricks. We'll start this lecture talking about the surgical ophthalmic table. The surgical ophthalmic table, as the patient comfort, will reflect the surgeon comfort. So, we will start talking about today about the ideal ophthalmic surgery. This is the ideal ophthalmic surgery table. As you see, this table is converted into 4 compartments. The first compartment, second, third, and fourth. This first compartment is for head. This compartment should be facing upward to the ceiling so that you can work comfortably. The second part is for the chest part. This should be supine and facing only ceiling. We can convert the chest part upward if you have a patient with difficulty in breathing. After elevation, we should change the head position to be facing upward ceiling, like that. So we can work comfortably. This is the basal part. The basal part is the one fixed to the base of the table. It can be elevated and depressed according to the level and elevation to be comfortable to the surgeon. The fourth part is for the leg. This one can be moved downwards like that. We can make the chest part to go back and reposition the head part. Back to the leg part. The leg part may be depressed like that. If we ask the patient to go outside the table like that. Do you see? The table must be in a supine or in this parallel position to the ceiling. And you are not allowed to put the table in this position. And in this position, you will increase the back pressure of the eye while you are doing surgery inside the eye. So this position is not good for ophthalmic surgery. But this position is suitable when the patient has a vasovagal attack. So you do this position to treat the vasovagal attack. Make the table back to its primary position. Make the patient supine, patient facing face of the patient facing ceiling. This table can be converted to a chair. So you can push the patient outside the operation room with the table and bring another patient. Like that. We elevate the chest part. Like that. Do you see? And depress the leg part like that. So it is converted to the chair and you can push the patient with the chair outside the room. You can control the movement of surgical table by 2 ways. The first way is by this remote control. This remote control has a power button with and a reset button that can convert the table to the chair. Button up and down for the head position or head movement part. The second for the back part or chest part up and down. The third for the leg part up and down, and the seat or basic part up and down, and for all the table to control the elevation and depression of all the table to control the height of the table. The second way you can control the movement of surgical table is by foot switch. You can use this foot switch while you are sterilized and you can't touch the remote control, so you can use the foot switch to move the table. The right foot switch is for the head down and up, and the left foot switch for the height down and up, and this is the power of foot switch. But you should know that every surgical table has a specific position for the head and the height. You may see another table that the height part is in the right and the head part so in the left. So you should know all the details of your surgical table